Hello, mic test. Lalagyan ko sarili ko. There we go. And I'm gonna wear my glasses tonight. Wait. Hello, good evening everybody. Welcome to my medical education stream. Hello, good evening everybody. Welcome. Tonight we're gonna talk about bedsores. Bedsores is a very common thing we see as surgeons, and probably you are very familiar with bedsores if you have relatives or know someone who is bedridden. They usually have bedsores. Someone who's paralyzed, someone who had a stroke and can't move, usually they have bedsores. Okay. Okay. So this will be a short one because I don't know how many slides is this. Parang ilang slides lang to eh. I think I only got like a really 26. Yeah, this is only a few slides. This is a short one because this is fairly easy to cover. So yeah, good morning Shiori. Hello, good evening. It is nighttime where I am. Wait, do I have the... I don't have the clock here. No, but I should put the clock on. Why do I not have the clock on my... We should put that. Let's put the clock. Where is the clock? Here it is. I'm gonna put the clock here also. There we go. Wait. There we go. Now we got the clock. We have the clock. Alright. So it is 9:12 p.m. We're gonna talk about bedsores. So chat, are you familiar? You guys are familiar with bedsores, yes? Are you guys familiar with bedsores? Are you guys familiar with bedsores? Do you know what bedsores are? I sleep all the time and maybe I have this. Oh my god. Yes, not really. I know they exist, but I don't know. I'm not sure how they work. Familiar. Okay. God, you know. Okay. Let's continue. I will explain bedsores. So, okay, we'll start by having a case presentation. Let's say we have a patient arrived at your clinic. Okay, we got ourselves a JTR, 100-year-old male, single from the Philippines. Came to you, Doc. Oh, well, not really. I don't think he's able to talk. He'll probably just smile at you. And let's say his relatives, let's say his cousin with the initials O. Just O. He has a cousin with the initial O, brought JTR to you, saying that we have to bring him here. Okay? So anyway, so what the chief complaint, generalized body weakness. So he just suddenly felt weak. Sabi ni O, si Kuya JTR nanghina. Sabi ni Kuya O. Sabi ni O na si Kuya JTR nanghihina. And then so you're like, okay. So the chief complaint is generalized body weakness. So we try to get his history, okay? So let's say 1 month is I made all of this up, by the way. But I just tried to remember a patient that is similar and then tried to remember what his history was. But anyway, so let's say he had a 1 month history of on and off fever and then started feeling weak. Okay, started feeling weak and then he had a decrease in appetite. And then they also noted that he had this wound on his lower back that was like small at first, and then it started growing. So it started first like it was red. His lower back would be red, and then there would be excoriations, and then it would darken until it became all black and smelly. Okay, it became black and smelly. So his condition was worsening. His conditioner, there we go. It eventually became foul, smelly, so it smelled nasty. So his symptoms worsened, so they went to the ER. He was admitted under internal medicine service for the generalized body weakness. And then they were like, internal medicine was like, this patient, JTR, we gotta refer to surgery because he has this weird wound on his back. So we gotta refer to surgery. So there, now you receive this patient. Okay. JTR, may pinapatamaan ka ba, Doc? I don't know. Who do you guys think JTR is? I'm just saying. It's JTR. And then, may pinsan siya na si letter O. Okay? Anyway, so yeah. So this is it. This is a short review of systems. So he had fever, generalized body weakness. You also note that he has numbness and weakness of the arms and legs. Actually, he can't move them. He can't move his arms and legs much, especially the legs. He's pretty much paralyzed, okay? This is a paralyzed patient. Okay, this is a paralyzed patient. So, after that, we get his past medical history, okay? So, he has hypertension, diabetes, cerebrovascular disease, chronic kidney disease, secondary to nephrolithiasis, bilateral, and he's on dialysis. Lahat ng sakit na pwede mong isipin, meron siya. Alright? Lahat ng pwedeng sakit, meron siya. So, we have, he has cerebrovascular disease is basically a medical term for stroke, by the way. So he had like a stroke 1 year prior, and he has residuals. When we say residuals, it means he still has the symptoms after the stroke. Okay. Virgin. And then he developed CKD. He developed CKD not because of hypertension or diabetes. He developed CKD because of kidney stones. Bilateral. Specifically yung CKD niya, hindi dahil sa hypertension niya tsaka diabetes dahil sa stones niya. Kawawa naman tong tatay yan, right? See, he has every disease imaginable. So anyway, so we know this is his history. Medical history, okay? So, he's on numerous medications. Hindi ko na nilista yung mga gamot. Basta lahat ng gamot sa mundo, iniinom niya. Okay? So, family history. So, yung pamilya ni JTR, merong hypertension, may diabetes, meron din, he also has cerebrovascular disease. They have prostate cancer, breast cancer, lahat ng cancer sa mundo meron sila. Okay, so the entire, his bloodline is filled with sakit. Okay? Kunwari lang. Okay? I actually put a few. So, anyway. Next. Personal social history. Walang bisyo, guys. Si JTR, 100 years pero walang bisyo. Non-smoker, non-alcoholic beverage drinker, denies illicit drug use, okay? That's all we know. That's all O could tell us, by the way. Okay. How did this guy make it to 100? Wala siyang bisyo eh. Wala siyang bisyo, okay? So, yan. Masamang damo ay pumabot ng 100 years. Alright. Okay, physical examination. Okay, this is pretty wordy, but I'll go through it. So, the first line, vital signs. Okay, his blood pressure is 130/90, so he's pretty much borderline hypertensive here. But he takes his meds he takes his meds, kaya medyo na, hindi naman umabot sa mataas-taas, diba? So, it's slightly controlled. His heart rate is a little fast, but it's within normal, 98 beats per minute. His respiratory rate is 23, a little fast, but not so much. It's a little fast. His temperature is 37, so that's within normal, okay? So, the patient is bedridden. Okay, wait, we have to the patient is bedridden. He's awake, alert, he follows your instructions, so if you tell him to smile, he will smile at you. GCS, so GCS is a Glasgow score. We use this. GCS is a scoring system used to assess the neurologic assessment. So when we say GCS 11, he is awake, but there's some for example, he doesn't answer there. He doesn't really answer you. He can't speak because of his stroke. So when we say E4, this is the eyes. The highest you can have for eyes is 4. V is vocal or voice. The highest you can have is 5. M is motor, so movement, and the highest you can have is 6. So the lowest, basically his eyes are good. He regards you well. He has regard. His eyes are good. His motor is good, that's why he follows instructions. If you tell him to smile, he will smile. But he cannot speak. If you ask him a question, he's just gonna look at you and smile at you. That's it. Okay? So that's what he has. Now, you listen to his lungs. He has clear breath sounds on the left, but he has crackles on the right lung base, so probably has pneumonia. He has pneumonia from lying down for so long. His heart sounds are within normal, so heart is good. It's just a little, it's just on the high side, but it's within normal. No murmurs. His abdomen is fine, soft and untender. No masses were palpated. It was good. I forgot to put in normal active bowel sounds. His abdomen is just fine. However, you notice in his lower extremities, his feet, he has swelling. Grade 1 bipedal edema means he has like some swelling on his feet. And there's strong pulses. Alright? Bakit di pa na x-ray to? Eba! Ano? Yung IM bala mag-x-ray dyan. And then, we notice on his back, guys, he has a 10 by 25 centimeter foul-smelling, non-healing wound in the sacral area. Sacral area is pretty much here. This right here. Sacral area is this. Encompassing the right and left buttocks with a central black S-scar. So it pretty much looks like this. Okay. This thing. So you notice on his back he has this. And it's stinky. It's a stinky. Nasaan yung buntot? Nawala yung buntot niya. Wala naman siyang buntot. Wala yung buntot niya. It's just, you just see this, man. You just see this. Nag-shrink yung buntot. Anal cutaneous fistula. Oh my god. Okay. Alright, so when we say S-scar, by the way, S-scar is the black area of a wound. So this one, that is the S-scar. Okay. When we say sacral area, it's pretty much here. You know the bony, you can, okay, chat, feel the back of your butt, in between your butt crack. That there's a bony part there, right? That's your sacral area, or at least this part up here, a little over the butt crack. The bony part, that's your sacral area. Okay, that's the sacral area. A little higher, a little above your butt crack. There's a bony part. That is the sacral area. Okay. So, yeah. Alright. So, what is a bed sore? So this is the question I asked you a while ago. No? Alright. Basically, a bed sore is area of damaged skin and tissues caused by sustained pressure. That's why, so what happens is there's increased pressure on a certain part of the body, usually at the back, where I showed you, the sacral area. And then when there's increased pressure there, what happens is there's pinching of the blood vessels in that area. Over here, you can see there's pinching of the blood vessels, so when the blood vessels are pinched, blood can't pass through. So there will be a decrease in the blood flow. And if there is no blood passing through, that means there is no oxygen. And when there is no oxygen, that means that tissue dies. Okay? That's how a bedsore forms. And that is also why a bedsore is also known as the cubitus ulcer, pressure sore, or a sacral ulcer, especially if it's in sacral area. But you can have a bedsore in other areas. Okay? Just like in this image. This one right here, it's a very, there's like multiple areas where you can develop sores, but it's not limited to these. Okay? So, this is why, chat. Wait, I will show you the areas affected by pressure. Okay. You see these? These areas that are being pointed by, see, the spinous process, the sacrum, the ischial tuberosity, the heels, these are bony prominences of your bodies. So, if they come in contact on a flat surface and you stay in the same position for a long period of time, very long period of time, these areas you're gonna be pinching the blood vessels there, and less oxygen flow or less blood flow, less oxygen, tissue dies. Okay, so that's why if you're sitting down like this, the pressure is applied here on your upper back, on the spinous process, the sacrum, the ischial tuberosity. Ischial tuberosity is the little bone here underneath. When you sit down under your buttock, there is a bony, you will feel like a bony part under your butt. Both sides, that's the ischial tuberosity. And your heel, okay? If you're lying flat, you have pressure on your heel, your sacrum, your elbows, your scapula, and even the back of your head, okay? If you're lying face down, pressure is applied on your toes, your knees, yes, even your genitals for the men, yung mga may dyan, men lang men, boobs para sa babae, okay? Your acromial process, which is in your shoulder, and then if you turn your head to the side, it's your cheek and your ear, okay? If you're lying on your side, it's on the malleolus, which is the bony part on the on your foot, it's on your ankle, the one that's like pointing outwards, that's the malleolus. And then the knee, the sides of the knee. Greater trochanter is the bone on the upper part of your thigh. And the ischium is like on your hip, okay? And then also the shoulder, your ear, and the side of your head. Okay? So these are all the areas where you could most likely develop a pressure sore or a bed sore. So that is why, chat, if you are just lying down on your bed, doing absolutely nothing and not moving, imagine this, you are killing your skin tissue. If you're lying flat on your bed, you're killing your sacral area. Magkakaroon kayo ng bed sore. And this is why sometimes when you lie down on your bed when you're just lying down on a bed for so long, parang nangingalay ka or parang masakit yung puwet area, di ba? Parang nangangalay, masakit na. That's it. That is why. Your body is telling you, hey, get up, man. Need oxygen. That part of your body is telling you, I need oxygen. Start moving and get up. Okay? Right. Is there a way to suspend myself in the air so that no pressure is applied to Hey, you don't need to be suspended in air for, just to avoid this. You can't avoid, like, getting pressure in it. That's why you have to move around. Okay? That's why you have to move around. There are stages of bed sores, by the way. So usually, if you do lie down for so long, and don't move, you will most probably reach like stage 1 to stage 2. Okay, stage 1 is just like a redness on the area. It's just like it'll look red. It'll be like a reddening of the skin. It's kind of like a sunburn without the skin peeling off. Kind of like a sunburn in a way, but not a sunburn. Basta, it'll be red. It's gonna be red and shiny. Okay? And then there is stage 2. Stage 2, so if you still prolong it after it's red and shiny, you prolong it some more. Stage 2, this is where we have excoriations, or it starts becoming a wound. An open wound. So, if you know the layers of the skin has different layers, okay? Skin has different layers. So, this top layer over here is called the epidermis. This one right here, the wider one, is the dermis. And then you have the fatty tissue under here. This is the subcutaneous or the fat tissue. The red one is muscle. And then this one here with the holes is bone. So, in stage 1, it's only at the epidermis. That's why it's just red. And then, stage 2, it reaches the dermis. So, this one is my sugat na. Parang it already has a wound. Okay? Okay. And then stage 3. Stage 3. Okay. The wound gets deep enough to reach the fatty area. Okay? Fatty area over here. And then stage 4 is muscle and bone. Okay? So the stages by depth. Is there an average amount of time before pressure becomes a problem? Yes, around like 2 hours. It can develop in as little as 2 hours. 2 to 3 hours. But when it does develop, it's just gonna be a stage 1. Okay. Let's see. Next. Here's another one, okay? Here's another one. So this A is stage 1. So it's just at the epidermis. Stage 2 is here. It reaches the dermis. Stage 3 is up to the fatty tissue. Stage 4 is muscle and bone. Now, if we have a bed sore, sometimes there are bed sores that are just black. It has a central S-scar. Just like our case with JTR, where it's just black. If you just see blackness, it's unstageable. Okay? It's just unstageable. But usually, once you remove the S-scar, it reaches the bone. So, most of the time, when we operate on this and we remove the black area, the S-scar, it's pretty much stage 4. Okay? Masakit ba yan, Doc? It should be, but the thing with pressure sores, or bed sores is that they are supposed to be painful, but the reason why they get this deep is because they usually affect people who are bedridden. So people who are bedridden include people who had a stroke, people who are paralyzed, people who have certain diseases or congenital diseases that make them unable to move properly, where they need assistance. So, of course, if you're paralyzed, you can't move. Sometimes you can't feel. So that's why it reaches this. If you are an active human being, that doesn't have any problems with the, is not bedridden, is not paralyzed, and you move around a lot, you're not gonna develop pressure sore. If you're lying down on a certain area for a long time, the worst you will get is a stage 1 before you start moving, because it's uncomfortable. Try lying down on a hard surface for 2 hours or more. You're gonna, mangangalay ka, you're gonna feel it. You're gonna feel it na parang ang sakit ng likod nyo. That's the pressure sore, that's the bed sore developing. Okay? Nerve is also involved. Yeah, nerve is also involved. But at this level, stage 1 to stage 2, you're supposed to be feeling it, because that is just skin level, and there's a lot of nerves here. So, yeah. I don't know if this is my mabdi kasi siya parang sugat. You should, if you are just lying down without moving, you have to like sit up and give you the area some fresh air. Okay? I think I have another one here. Oh no, I don't. Okay. So that is why when it comes to bed sores, okay, bed sores are hard to take care of. They are hard. Very hard to take care of. I personally, as a doctor, as a surgeon, I mean, it applies to many other surgeons. We do not really like having to deal with pressure sores, because these are wounds that are preventable. Like, totally preventable. And when it comes to pressure sores or bed sores, it is better to... Prevention is better than cure. Okay? And one of the ways prevent bed sores, if you're handling a bedridden patient, you have to turn them or change their position every 2 hours. So if they're lying flat on the bed, you can allow them to lie flat on their bed for 2 hours, and then you have to change their position to side view for another 2 hours. And then after that, you can put them back flat. And then 2 hours, you turn them to the other side. Then 2 hours flat. Then 2 hours the other side. 2 hours, you just turn them. Hello, Chef Pumpkin. Hello. Yeah. Every 2 hours. Okay. Now, this is something... in the hospital setting, this is the job of the nurse in charge. Okay? A lot of doctors and even a lot of senior nurses that I know, or even doctors, if in tertiary hospitals or big hospitals, mga talagang big hospitals, as far as I know, if a nurse has a patient that develops a bed sore during their, while the patient's in the hospital, during their shifts, it's the nurse's fault. It is the nurse's fault. They're supposed to turn the patient properly. They are trained to do that, so they're supposed to do it. A lot of times, I would hear like, a doctor once, I was doing rounds with one doctor before, surgeon, he got really mad at a nurse, and he would tell them, this is poor nursing care. So, he really got angry. He was angry because the patient he had already had a wound that he was taking care of, and this patient developed a new wound because he's a bedridden patient. A new wound, it's a bed sore. So he got really mad because he's already taking care of a wound and then nadagdagan pa, di ba? He got really mad at the nurse. It was poor nursing care. It's considered poor nursing care if a patient develops bed sore in the hospital. So, because it is the nurse's job to turn the patient. Okay? That is their job. If they're in charge of a patient, they have to turn the patient every 2 hours. Because you want to prevent them from getting a bedsore. Okay? Can this be avoided by using ultra soft bed? Yes! Okay. That is why we have soft beds. Because it reduces the pressure. This is an egg crate mattress. Alam mo yung mga mattress na may parang ganito, mukhang lalagyan ng egg. This is an egg crate mattress. This is one of the mattresses that is suggested for people who are close to developing bedsores. So it's really soft and comfy. Soft beddings will help lessen bedsores because it's soft. Okay. But it's just one of the things that will help. You can't just have this kind of mattress and not turn the patient. You still have to turn the patient because eventually the pressure builds up. Okay, so yeah. But it will help with preventing bedsore. Also, aside from that, cleaning. Hygiene and cleaning the area suspected of bedsore, especially the sacral area. This area right here. If you have a bedridden patient, malamang naka-pampers yun, diba? Naka-diaper. The patient is on a diaper. If they're bedridden and paralyzed, they're on a diaper, and they will just poop and pee. And if they're just lying flat, their poop and pee can go to the back. And if you leave it there, it can irritate the skin. Tapos nakahiga sila, naka-flat, diba? Walang oxygen, it worsens it. Okay? That's why it is also the nurse's job. When they have a patient that's bedridden, see, they also have to clean. They have to change the diaper, clean. They always have to check the area of high pressure if there is any bedsore development. And they gotta make sure it is clean and dry. Okay? So imagine, if you're not in the hospital, you have a relative, let's say you were put in charge. Ikaw yung one and only relative ni JTR. Diba? JTR, ang daming sakit. May bedsore na. You're gonna have to take care of it. You're gonna be the one. And you're the only one he has. Ikaw lang yung nag-aalaga sa kanya. You're the only one taking care of poor JTR. You're going to have to do all this for JTR. For patient JTR. You're gonna have to turn him every 2 hours. You're gonna have to get him a nice soft mattress for his bed. And then you're gonna have to clean him every day. So, you can see why bedsore is actually not easy. Preventing it is the best way. You know, it's the best way because you prevent it. It doesn't get any worse. As long as you turn them every 2 hours, you are able to clean them every now and then. Everything is good. But once they develop bedsore, it gets complicated. I once had a colostomy poop bag explode on me. Cleaning a bedsore is better. Are you kidding me? A colostomy bag exploding is so easily cleanable. Well, of course not on you, but on the patient. The poop that comes out of colostomy does not irritate the skin per se. A bedsore, cleaning a bedsore that's as large as my face is like hard because you have to turn the patient, you have to change the dressing every day. Yeah. Poor Kuya O. O nga, imagine mo si O, ginagawa niya to araw-araw para kay Kuya JTR, diba? Ikaw na lang mag-alaga kay JTR. Ayoko si O na bahala doon. I'm not a nurse. I'm not a nurse. The only thing I'm gonna do here is the only time a surgeon is gonna, be hands-on with this is pag naging sugat na talaga. This is why we tell you guys, prevention is better than cure. Sweet! Thank you for being a member. Oh, speaking of, segue. Speaking of, I think let's do another membership stream soon. I'll see what I can do. What's this? Is it okay to fart in their hand if they're wearing gloves when they're washing the butt? Because nurses are used to all manner of excretions from the body. Like, you farting on a nurse is nothing. Because they already handle, like, worse things. Okay? I mean, nurses that handle patients like this, that have bedsores, while they're changing the diaper and, taking care of sometimes the patient is pooping while they're changing the diaper. And it happens. It happens. Okay? It happens. Okay? So, what's next? Reiteration! Prevention is better than cure. Okay, so, like I said, if you know somebody or have a relative who is bedridden and is prone to developing bedsore, you guys know what to do. Okay, like if you have a relative that is bedridden, you can tell the person taking care, "Oi, turn him every 2 hours." You also know which are the high pressure areas. That's why. Wait, let's go back here. Where's the turning? Notice how when you turn the patient. Okay, notice how when you turn them to the side, there is a pillow in between the legs. Because if you don't put a pillow between the legs and you have the knees onto each other like this, they will develop bedsore on both sides. They will develop a bedsore here and here. So that's why you have to put a pillow in between. And then you put a pillow on the back so that they don't fall flat in the bed. But this is very important. The pillow between the legs, this is very important. Okay? Not gonna lie, despite the rivalry of nurses and medtechs, I still highly respect nurses for direct contact in those patient cares. I'm happy to hide in the lab and testing. Yeah, the nurses deal with all this. Imagine this. I'm pretty sure a nurse that has to, especially ICU, especially ICU nurses. In ICU, a lot of patients they're not really bedridden or they didn't have stroke, but there are a lot of patients that once they are intubated, they are at risk of developing bedsore because they can't move from the bed, they're intubated. So the nurse has to turn them. Because intubated patients are really prone to developing sacral ulcers or bedsores at the back. So that's why the nurse has to watch them. That's why the nurses really need to watch out. I have, let's say, there are certain hospitals. I mean, I can understand some hospitals, a lot of hospitals here in the Philippines, once na-admit ng pasyente sa ICU, magkaka-bedsore yun. In a lot of hospitals, okay? Because some nurses, you know how some hospitals are understaffed, like not enough nurses on duty to handle the many patients that they have in the wards or even the ICU. So they are very busy that they are unable to turn patients. So, in some hospitals, some doctors expect na once may pasyenteng na-admit sa ICU, they're gonna expect a bedsore. Like, the entire ICU, may bedsore. May bedsore lahat! So yeah. It's like, I can't fully blame the nurses because once a patient develops bedsore, it's usually the nurse's fault. They didn't turn the patient. They're supposed to turn the patient, they didn't. But you can't fully blame them because if they're, overworked or undermanned, that they can't exactly turn, because turning patients is not easy, especially when they're bedridden. You have to move every part of their body and position them, and then you have to deal with another patient. I know it's not easy. So it's tough. It's tough, but yeah. They almost never show preventing bedsores in medical shows. Yeah, because this is something that, I don't know, not talked about much, I guess. And yeah, you're right, in medical shows. Probably because they don't notice it. You won't notice a bedsore until you turn a patient. Until you just turn a patient and you see something right there in the back. Kaya nga kulang nasa nurses tapos mamalitin pa ng nabugbog sa airport. Wait, I have not heard of this one, yung nabugbog sa airport. Hindi ko alam yung balitang yun. I don't know that. I'll look that up later. But yeah, here in the Philippines, you know how undermanned the hospitals are, especially government hospitals. Actually, not even just government hospitals. Even tertiary hospitals. Even the private hospitals, they also lack, some private hospitals lack nurses because nurses are not paid well here. They go abroad. They work 2 years here to get the experience, and then they work abroad after. That is, I don't know. Doc, may pag-asa pa po ba kung pag bedridden na? Most of the time, no. Because depending on the reason for being bedridden, if it's a stroke with residuals, they're bedridden. If it's paralysis, they're bedridden for life. Now, if they're just bedridden because they had a let's say a severe pneumonia where they need to be intubated, then that one they have a chance, because once the pneumonia's cleared and they're extubated, they can move around after and they'll be okay. It's just that when they are intubated, they can't move around, so the nurse has to make sure that they are turned properly because they can get a bedsore. Most hospitals are very understaffed, unfortunately. Yeah, exactly. It's a crisis. And then it doesn't help that healthcare workers get a lot of shit also. Get a lot of shit from people. I mean, you guys have seen, you probably know yung that yung sino yan? Yung kay Tulpo. I think he said some shit like a few weeks ago, which kind of pissed off a lot of people. Yung parang what did he say again? He said like kung ayaw, if you don't like your working in the hospital, your job, then resign, you are replaceable, yada yada. That one, what the hell, man? That was a shitty thing to say, because what if they take his advice and everyone resigns, and di wala nang doctor at nurse dito, diba? We're already undermanned. Tapos he's gonna say stuff like that. Like, what the hell, man? Yeah, he said that. It was like, I forgot the exact words, but it's like, it's scattered around Facebook, man. It actually pissed me off. It pissed a lot of people off. Let's see, Speaking of which, yung kapatid kong nurse nung Lunes, mga 2 a.m. na nakauwi dahil absent yung mga katrabaho sa baha. Kaso 6 a.m. yung sunod na katrabaho. Buti pinayagan na 8 a.m. Yeah, well, it's baha eh. It's flooded. Here in our hospital, we do have this policy that we also teach our relatives or kasama patient that eternity. Yeah, sometimes they do that. Some nurses, kung hindi nila kaya or if they need some help, they have, kung may bantay yung pasyente, let's say JTR, kailangan may bantay si O. The nurses can teach O to turn JTR. We're glad to have interest from mankind. Yeah. Shepherd control privilege. I think he was the same guy that complained when, I think, like a few years ago, I think they accidentally hit a kid or something, and then what they did is, they accidentally hit this kid somewhere, and then they brought him to PGH. Which was weird because they brought him to a PGH, when they could have brought the kid to a nearer hospital, but no, they had to bring the kid to PGH. Tapos, I think the resident in PGH, the ER resident or whatever, was the one handling the situation. And the resident or the doctor there assessed the kid to be okay. So he had to attend to other more urgent patients. And then I think Tulfo complained that parang, he ignored this. This is an emergency, yada yada. Emergency to, I hit this kid, blah blah blah. Like, what the hell, bro? Like, the doctor assessed him, and if it's not urgent, then it's not. Anong ibang mattress na pwedeng iwasan ng bedsore? Any soft mattresses are good. Okay, any soft mattress is good for your body. This is the best one though. For people who are prone to developing bedsores, get an egg crate mattress. Okay, so as I said, prevention is better than cure. Now, let's say in our case, in the case that I mentioned a while ago, si JTR was taken to the ER and he already has a bed sore na maitim na, it's black already. So, prevention was not done, so we have to go to the cure. Okay. So, what if we get a patient that has bed sore? What do we do? Alright. Depending on the stage of the bed sore, let's say the patient is stage 1 to stage 2. Stage 1 to stage 2, you can, it is conservative management, okay? Conservative. You don't need surgery for it. It's conservative and you continue prevention. So if you have a stage 1, remember, stage 1 bed sore is just epidermis. Stage 2 is dermis. So stage 2 is there's slight ulceration. Now in stage 1, it's just redness. So all you gotta do is just do the preventive methods. Just turn the patient frequently every 2 hours. Use a soft mattress. Make sure the area is dry. The same goes for stage 2 bed sores. Turn the patient. Reduce pressure. You can also, since it's like an open wound, you can add ointments. The most common one I see is calmoseptin or zinc oxide. So I see this a lot. You can put this. You can put this. You can put creams like this or ointments. Okay, this is the one I see a lot. Calmoseptin. It looks like it looks like a pink toothpaste. They just apply it. Okay. So yeah, that is for stage 1 and 2. And then, I think there's also other There are also other ointments like mupirocin, but that's an antibiotic, topical antibiotic. They also have like Mebo. There's different kinds of ointments. Any ointments for open wounds, those are good. Those are good. At least the mupirocin will help prevent infections and stuff. Nostalgic ointment. Yeah, this is the most common one I've seen. Betadine is just a cleanser. Betadine is like, it's an antiseptic. All it does is clean. It doesn't do anything else. Okay. Now, if we're in stage 3 to 4, or even the unstageable ones. So stage 3, the wound goes as deep as the fat tissue. Stage 4 is muscle and bone. These kinds of bed sores may require more like surgical or more invasive procedures. Okay? And one of them is wound debridement. So in wound debridement, what we do is we surgically remove the dead tissues. So here we go. See this? The yellow stuff and the black stuff, we remove them. We excise them, we remove them, and then we wash the area. We rinse the area with betadine, saline, sometimes hydrogen peroxide. And then after that, it's supposed to look like this. What happens is once you remove all the dead tissue, new tissue can grow. So healing will start. And what we do is once we remove the dead tissue, we cover this up in the most common ones is called a wet to dry dressing. So you get gauze, you wet it with saline, you stuff it in the wound, and then cover it with dry gauze, and then just tape it over. And then wound care will be every day, once to twice a day. The same way. Wet to dry dressing. Just put wet gauze in there and then remove. There are some dressings that are specialized. Like, these are the more expensive ones, like Duoderm or Betaplast. Those kinds of dressings. Specialized dressings. They're more expensive, but they're effective too. But yeah. Is it the same with mupirocin? What do you mean? Is what the same as mupirocin? Mupirocin is a local topical antibiotic. It's an ointment. You can use that. It just helps with the irritation. And now, so depending on how bad the wound is, or how big, how deep, sometimes wound debridement needs to be more like, it's not a one-time thing. Sometimes you need to repeat it. Like every few days, you have to repeat the wound debridement process until the wound looks like it's really healing up. Then you don't need to anymore. Like, because sometimes you would remove all these dead tissues, and then after 4 days, you would still see a little more dead tissue, and then you have to go back to the operating room to remove all that again. Yeah. Doc, legit ba yung paglalagay ng amoxicillin diretso sa... No! No, do not do that! No! Oh my god. We had a lot of patients that do that, yo. They're like, they have a wound, and then they go to the ER saying their wound got infected, and then you see white stuff all over their wound, and you're like, what is this? Ano tong mga puti-puti? Antibiotic yan, yung amoxicillin, kasi yung binili namin, tapos binuksan namin yung capsule, tapos nilagay sa wound. No! No! And I would be like, no! We would be like, ma'am, sir,
ang antibiotic na capsule iniinom, hindi nilalagay hindi nilalagay diretso sa sugat. There is a reason why it's called a capsule that you take orally. Okay? So no, do not do that. Kaya na lalong na-infect eh. No. Connected! Wait, there we go. I got disconnected for a bit. Am I back? Am I back? I got disconnected for a bit. This happened. Para diretso sa sugat yung antibiotic, madi-dissolve lang sa sugat. Okay, I'm back. Okay. Alright, no. This is why when you buy meds, there are instructions on how to take them. Okay? If you buy a capsule, you take it per orum, or you drink it, or you swallow it. You don't open it up and just pour everything on your wound. It doesn't work that way. Okay? It doesn't work that way. If you want to put antibiotic on the wound itself, you buy an antibiotic that is topical, that you actually apply, which is ointments and creams, man. Ointments. Huwag kayo mag-rage artist. Kayo kasi, tinrigger mo eh. Naglalagay kayo ng amoxicillin sa sugat nyo. Yung capsule. Yung powder ng capsule. Langya kayo. Narinig ni Mother yung naglalagay ng amoxicillin diretso sa sugat. Ang tanga naman daw. Anyway, yeah, do not do that, okay? If you see someone doing that, please tell them do not. Don't do that. That is the wrong way. It's like, it's pretty much like putting malunggay leaves on your wound. But instead of using leaves, you're using, like, we physical therapists use infrared light to aid wound healing that hasten the process of drying the wound. Ooh! Have I ever had one? I have never had infrared. You know, I had when I had my wound, when I had my wrist problem, they didn't put infrared light. They used a machine on my hand. I forgot what it was. Hindi ko maalala kung ano siya. I think it was an ultrasound or something. It felt nice. Grabe kayo sa mod ban yan. Anyway, yeah. Okay, guys. Do not use medicine in a different way from how they are intended to be used. Okay? Alright, so alright, next. I think here we go. I stole this from the internet, guys. Management pathway for pressure sores or bed sores. If a patient has a bed sore, is it grade 1 or grade 2? If it's a grade 1, grade 2, conservative management, okay? And then just monitor. Okay? Now, does the patient require surgery? Usually, no. Right? So, no. Consider, what is this? How does this, okay. Consider autolytic enzymatic larva mechanical. What the hell? No, you don't need this. Basta pag I haven't reached this point, but as long as the grade 1 or grade 2 pressure sore doesn't get any worse, it's okay. But if we go to a pressure sore that is grade 3 or grade 4, so if it's grade 1 or grade 2 and if it's not grade 1 or grade 2 and it's grade 3, grade 4, you have to do surgical wound debridement. And they usually require surgery, so yes. Okay.
So yeah, that's basically it. Itong mga autolytic enzymatic larval mechanical stuff, if I remember correctly, in some places or even way back before, they would use larvae to do wound debridement. You know how like diabetic feet, sometimes diabetic feet or wounds like that, they would have maggots. I have seen a foot with maggots. It's disgusting, to be honest. I have seen a diabetic foot with maggots, and it is the most disgusting thing I've ever seen. It's gross. I don't even want to touch it, but I have seen it, and it is very ill. But I was told, and we learned that those maggots, they actually are good for the breed. They actually eat up the dead tissues. So they're kind of good. Maggots are friends, but they're gross as hell. They're disgusting, man. It is disgusting. I have seen it. I have seen it on diabetic feet. I have seen it on a non-healing wound on the scalp, by the way, on the head. The scalp. I have seen it, and it is disgusting. I have seen it in breast cancer. The type of breast cancer that's like eating up the skin of the entire breast. I have seen it, and oh my god, that is disgusting. It is gross, man. It stinks. Yes, it stinks so bad. It smells. Yeah, it's gross. It's really gross. It is disgusting. It is disgusting. Like, that is something that I had to deal with as a resident. As a junior resident, by the way. But when I became a senior resident, I'm like, nope, I ain't touching that, okay? You get the first years. We're the first years and second years. You guys are in charge of this. I'm not touching that. Kayo na bahala dyan. Ayoko dyan. Oh my god, we got breast cancer patient with maggots all over it. No, okay, that ain't mine. I'm gonna call a junior. Oy, ikaw na lang dito. Ayoko niyan. Kaya ikaw na bahala mag-alaga nito. I ain't touching this, man. Like, I have gone through this in my first and second years. It's your turn. I ain't touching this, man. It is gross. It is really gross, but it is disgusting. It's hazing. Oh my god. Come to think of it, it is kind of like hazing, but it's like, it's not the physical type. It's not the physical pain type of hazing. It's more like mental mental preparedness, and I don't know. You're not hurting them physically, you're hurting them mentally. You're putting their mental to the test. Yeah, emotional damage. Oh god. Yeah, we all had to go through that, by the way. It's something you can't escape, man. As a surgeon, even as a surgeon, whether or not you're a junior or a senior or a consultant, you're gonna run into something like that. And it is disgusting, so might as well expose them while they're young, right? Eventually, they'll have to deal with that. Expose them while they're young so they know. So that when they, hindi sila magugulat. God. Plus 30 trauma. Paano nagkakamagot? Oh. Usually, maggots, you know what where maggots come from? They come from flies. So, an exposed foot that's smelly, may nilalangaw, di ba? Anything that stinks, nilalangaw, di ba? Di maglalagay sila ng itlog dun sa It happens. Nahayaan na langawin yung sugat nila, hindi nagkakamaggots. That's basically how it happens. Yung pressure sore na wala pang sore, pwedeng i-massage. You don't massage it. You're not supposed to apply. It's a pressure sore. You're not supposed to apply pressure. Just let the area breathe. That's it. Farmed and breeded yung hospital grade maggots. Yeah, there are maggots that are there are maggots that are like hospital bred, and they use it for the breedment. I've heard of those. But the maggots that I see in my patients before, those are not hospital bred. Those are like home bred. Yung tipong nagkasugat doon, nasa bahay, hinayaang langawin yung sugat nila, hindi nagkamagots, diba? Those are home-bred maggots. That is not hospital bred, yo. Flies impregnate your wound and the maggot becomes your child. Technically, what the hell is... No way, what the hell are you saying? What the hell are you saying? Isn't it leeches? Not leeches suck blood. That is different. Maggots are the ones that eat up dead tissues. Maggots are flies. Why, yes, they are. And that is my last slide, by the way. See, I told you it's a short one. This is a short one. I have seen maggots on a foot, maggots on the scalp, maggots on a breast, maggots on a leg. It is not pretty. It is disgusting. Sila yung nasa zombie. It's really gross. It's really gross. Like, you can search it up on Google para lang makita mo. Gaano kakadiri. May kilala ba kayo nag-autopsy? No, I don't know any. Sa loob ng tenga at ilong, oh my god. You know, I've actually seen bedsores on the ear. I've seen an ear bedsore, and it was weird to me because I was like, I was like thinking, what the hell? I rarely see ear bedsores. Usually I would see them on like the heels of the feet, the back, or on like the knees, but on the ear, that was weird. I have seen a bedsore on a baby's head, by the way. So that means hindi iniikot yung baby. Nagka-bedsore sa ulo yung baby. That was like sad to me. I'm like, oh my god, baby pa lang to nagka-bedsore na sa ulo. Ito pala yung ointment mo na. Okay, shrouded, AC or shrouded, if you're having bedsore, stop lying down on the same position. Change your position every 2 hours. Change your mattress, and when you are awake, like, get up. Don't stay lying down. Get up and sit down somewhere, or and yeah, you can put, if it's like a wound already, put an ointment. Okay, don't. This is why you don't stay lying down for a long time, okay? You don't want to get bed sores. When the position is so good, you acquired bed sores. Baka naman mainit yung hinigaan. Probably, but it was a bed sore. So all factors rule in. It was on the back of the head, so it's most likely a bed sore. Tulog kasi ako dati. Yeah, it's time for you to wake up. Just sleep for like 6 to 8 hours and then get up. Don't. Okay. I mean, even if you're sleeping, your body from time to time will move on its own. You don't stay asleep in the same position the entire time. Your body will, you tend to move in your sleep. So that's why when you sleep at night, you don't really develop bed sore because you actually turn from time to time. And also because you're on a soft bed. Unless your mattress is hard and not good anymore, then yeah, you have to change your mattress to something softer. Sa mga mag-shot na nakakatapos lang, please nahugutin nyo. Ano pa yun ang Bedsores tayo na? So anyway, you guys have any questions? Because yeah, this is the stream. It's pretty short. It's a short one. Gusto niyo ng quiz? So moral of the story, wag ka na matulog. Okay, quiz na lang. Since wala kayong tanong, ako magtatanong. Siguro naman nakinig kayo, no? Okay, chat. What we want is 1/4. Oops, hold on. One-fourth sheet. One-fourth sheet. Inaantok ako, may pasok bukas, suspended. Ay, suspended. Bukas yung suspended, hindi ngayon. Walang suspended. Baha pa, Dok. Wala. Baha. Nanonood naman kayo sa cellphone. May baha nga. May baha pa nga. May nagsa-cellphone pa rin kayo. So, pwede. Okay, since naka-cellphone kayo, pwede kayo mag-quiz. Okay, number 1. Okay. Number 1, sino yung pasyente sa kasong to? Anong initials ng pasyente sa kasong to? Okay, that's number 1. Patient. 2. Yung initials lang. JTR. Okay. Patient bedsore. Sino ba kasi yun? Kawawa naman yun, lahat ng sakit na meron siya. Wait. Okay, number 2. Okay, number 2. Another name for bedsore. I already gave you I think I gave you 2 other names for bedsore. Other name. I even mentioned the other name for bedsore. I think I gave you 3 other names. I'm using my mouse kaya pangit yung sulat ko.
pressure sore, sorbet. Gago, ngayon ko lang nag-gets kung sino yung patient. Okay. Pressure ulcer. Okay, yeah. Pressure sore, pressure ulcer, decubitus ulcer, sacral ulcer. Although sacral ulcer is more in the back, but yeah, we say it. We pretty much see that. Okay, number 3. Number 3, ilang taon si JTR dito sa case na to? How old si JTR? How old? Ilang taon si JTR dito sa kasong to? Sa kaso na to, just here. And really ages. Centenarian, tapos single pa rin. $69 tayo. Dapat pala, sinulat ko nga 69. Okay, 100. It's 100, okay. Number 4. How many stages of bedsores are there? How many stages? Nakinig kayo, alam nyo. Okay, yeah, the answer is 4. Ba, mukhang mapaperfect nyo to, Mga nakinig talaga. Okay. Sige. Which stage of bedsore reaches the fatty tissue? Stage bedsore that reaches fatty tissue, basically the fatty layer, fatty tissue. Nangopia. 3. Tumingin sa katabi po. 3. Okay. Okay, yeah. Okay, it is 3. Yeah, stage 3. Basta fat, stage 3. And then if it's muscle and bone, it's stage 4. 1 is epidermis, 2 is dermis. Okay, mukhang pasado kayo, Mukhang pasado kayo. Buti naman, except yung man late. Mukhang pasado kayo. Ready? You guys passed the quiz. That means you are ready to take care of JTR's bedsore. Pwede nyo nang alagaan nyo si JTR pag yung bedsore niya. Let's go back. Bisit mali pa kinopyahan. Yan kasi. Nangungopya ka pa. Mali naman. I just got the JTR. Ngayon lang nila... Ngayon yun lang kilala yung pasyente. Mga late. Mga late. Nala si O dyan. Si JTR, tapos yung kasama niya si O. O has it covered. Yawo. Ayaw yung alagaan si JTR. Grabe naman kayo. Kawawa naman si JTR. Walang gusto mag-alaga sa kanya. Si O na lang. Doc, sino po ba si JTR? Secret. Secret yan si JTR. Basta. Inaalagaan ni O. Siguro next ano to? Next, ang tawag dito. Next medical education stream, iba naman yung ano. Kawawa naman si JTR, lagi ko siyang ginagamit as pasyente. Sino bang ano? Ano bang next topic? Pwede naman si MP naman gamitin ko. Si MP. Babae naman, si MP naman. Okay. Bakit talaga nang galit nito kay JT? Doc, sinuwi daw po susunod. Diyos ko. Alright, we good. 1 hour 30 minutes. Yeah, we good. We are good for tonight. Thank you guys for coming to my stream. I hope you guys learned a lot about Bedsores. My next stream will be kailan ba? What is my next stream? My next stream will be tomorrow. Tomorrow ba? Oh yeah. Tomorrow, 9 p.m. I'm gonna be playing, I'll be on Twitch. I'm gonna continue Doom. Doom the Dark Ages. Yeah. And then on Friday night Tekken with viewers. And then Saturday, Yosha, thank you for the membership! Yeah. I'll see if we can do another membership stream by the bells. I'll see. I just don't know what to do. Okay, walang iya, kawawa yun si JTR. Wait, okay, I'm gonna try. Let's see, is there anyone I can actually... Wait, I wanna try something. I have not... How do I... I'm gonna see if I can redirect here on YouTube or raid. I don't know how. Tingnan ko kung pwede. How to raid? Teka, ito ba? Permissions. Community? How do you raid on this? Wait lang ah. I don't know how to raid. Ito. Oh wait, I think it's here. What the hell? Need ng permission. Yeah, I was like, how to redirect in YouTube.
Wendell told me how. I was able to enable it. Okay, go to live tab. Oh wait, no. How do you redirect? Ang hirap naman ito. Ang daming gagawin. Is it here? How the heck do you redirect on YouTube, man? Ito. Raid? I'm trying to, but I just don't know how. I mean, I know there's like a... Do I have to go to the person's channel to like redirect? Or do I have to do it from like my dashboard? I don't know how to redirect. How to redirect? How to redirect a live stream in YouTube? How to use YouTube Live redirect? Oh, click on it, go to Live tab, over the video and the redirect from. Oh, okay. I have to go, okay, and then click customization. Oh, it is not here. The redirection thing is not here. What? Oh, ito. I think I got it. Redirect. Here we go. Add. Oh. Oh, okay. I found it. Okay. But all the people I can redirect. What the heck? Wala bang ano? Wala bang live na pwede? Sa lahat na, oh god. Okay, out of all the people na pwede kong i-redirect. Wait, let's see. Let's see who's, let me go on YouTube and see. Gagi, ngayon ko lang nalaman. Oh my god, you guys are so slow. You don't know who JTR. Ang babagal nyo! Napaka-late yung pa-end na ng stream. Magre-redirect ako. Tapos hindi. Ano ba yan? Okay. Oh, wait. Okay, let's try. You think, sino kasi? Si J-Pong itira. I don't know who to raid though. Yung mga pwedeng i-raid, tingnan mo to. Ito yung Vox Akuman ni G-Sanji. Mga malalaking streamer. Wala si ano. Oh no, Gerard's not live. I have never, Wait, can I ask you guys something? When you do a redirect on YouTube, does the streamer know if you get raided, or is it like a ninja raid where you just suddenly redirected there and then you do? Wala si Millie. No, Millie's not on. There's actually no one for me to raid. Ah, they know. I see. They will know. Oh, okay. Oh, wait. Do you guys know Riser Blazing Fang? That's another dinosaur VTuber na lalaki sa first stage production. Can I raid this guy? Can we raid him? He is streaming Resident Evil. Let me look at his stream right now. Because there's no one else for me to raid. Riser Blazon. Baka hindi niyo kilala. Do you guys know Riser Blazon Fang? He's like a dinosaur VTuber. He's a dude. He's a guy. He's under first stage production EN. He's a dinosaur VTuber. I think he's collabed with some PH VTubers. Actually, I don't know if he's Filipino, but he knows Tagalog. He knows Tagalog. Hindi ko alam kung Filipino talaga to. Or if he's just a dude that knows Tagalog. Because everyone else that I have here, I can't... Nakakahiya naman mang-raid sa kanila. Tiyo mo, oh. Si Takadashi Kiara. Sino to? Si Vox Akuma. Si Yofi, tapos si... Puro malalaki. Hindi ko masyadong One raid to find out. Let's type support raid. I am not familiar kasi with like YouTube chat culture. Because there is no one else I can... Wait, let me see. Ano pa ba? Wala eh. Just do it. Okay, we'll go raid. Sige, we'll try raiding Riser Blazon Fang. Should I? Because I don't know. I don't know YouTube chat culture and shit. Doc, let's try raiding a HoloLive member and see how they will react to a Shiori raid. Is it safe to even do that? Nakakahiya kasi hindi ko, like for example, me raiding Kiara? Magugulat. Like, who's this small timer raiding me? Kung si Gerard pwede na sana eh, pero wala eh. Or Octavio, but wala. I think I'll hold off raiding for now. Let's raid next time. I'll raid next time na lang. Next time na lang tayo mag-redirect. Na? I'll do it next time. Jepong, hanggang ngayon hindi mo pa-gets kung sino si JTR. I'll raid next time. The next time I do a YouTube stream. Okay. Medyo nahihiya ako. I'm shy. I'm a Twitch streamer, man. I'm not really a YouTube streamer. Hindi ko alam yung mga... Raid some completely unrelated streamer like a family vlog. Tapos, magme-message kayo, support raid. Okay, hindi. Next time na lang, guys. Next time. Alright. Goodbye, guys. Thank you for coming to my stream. I'll see you guys tomorrow on Twitch. I'll be playing Doom. I want to finish the game. Hopefully, I can finish the game soon so I can free up space on my PC. So, yes. Otsupon! Bye-bye! Good night. Ayaw mag-raid. Nahiya na ako. Bye-bye. Good night.